I think giving people the knowledge they need to establish high quality registries that are sustainable. So I probably suggest the best step we could do is look at establishing a centre of excellence for registries that allows people to draw on that expertise, draw on common resources to improve the quality of registries and make sure people are aware of just what they need to invest to develop a registry to the point where you actually realise the potential that it has.
Well, I think the biggest challenge is in Ireland we have all sorts of systems at all sorts of levels. They're quite complex, and I think bringing them together in some useful, accessible way for everybody who needs to access them is the biggest challenge. It's a bit of a morass of all sorts of systems out there.
Biggest challenge at the moment, I think, is definitely around information governance. How do we actually manage the security of that information, who's appropriate to see that information, the legitimate relationship for having it, and the consent of the patient to actually put their name into that registry, and how that goes forward?
From our point of view, we've been at this project about 2.5 years now, and the clinicians involved in the main hospitals, the biggest challenge for them is finding protected time to do this work. So we are driving it from Fighting Blindness, but we need to be able to give them time and allow them to take time to do this really important work. So obviously resources are always going to be an issue, but also time is a really, really important part. So giving them time to do it is a challenging aspect of the job.
Well, there are quite a lot of challenges to setting up patient registries. I think one of the challenges to whether it's setting them up or running them is data standards, data quality, data interoperability, data having data that is understandable across multiple domains, and also of good quality, complete and meaningful and accurate and all of the rest of it, because for comparing with clinical trials we really need to make sure the data is good quality.